So I just say welcome, Dr. Cole, and thank you for taking the time out of your busy schedule to come to Franklin County.
It's my honor to be here. Thank you so much. And seeing the bust of Benjamin Franklin in the background, I think we'll start with a quote. Those who would give up a little liberty for temporary safety deserve neither liberty nor safety. And, you know, I know it's hard to listen to all this information. I think a lot of people do have COVID fatigue. I understand that. But at this point, it's not just about COVID. It's about what's going forward as well. I'm Dr. Ryan Cole. I'm a board-certified anatomic and clinical pathologist trained at the Mayo Clinic. I have 500,000 patients of diagnostic experience in my career. If you Google me, I'm probably one of the worst doctors on the planet, according to Google, yet I've been humbled and honored to present in the EU Parliament, UK Parliament, Italian Senate, Croatian Parliament, Romanian Parliament, Japanese Parliament, US Senate, US Congress multiple times. And when the whole world is silent, telling the truth is a revolutionary act. And I'm here to tell the truth. And, you know, as we found out over the last week, how much of our own federal funding has gone to suppress the speech of those who are trying to tell the truth. It's very unfortunate. I'm not here to judge anybody who took a shot, didn't take a shot. I'm here to recommend that nobody ever takes another genetic shot. I feel for all those who have been injured, and my heart goes out to those who are still suffering. And I'm here to just share a little bit of science, and hopefully we can rectify the situation the best way we can, but at the very least protect the citizens. I didn't take an oath to any administrator, any hospital, any organization. I took an oath when I became a physician to a patient. And at the end of the day, a lot of physicians have really lost connection to that oath. And it's very unfortunate, wittingly or unwittingly. You know, they bought into a lot of the narrative and a lot of, you know, the junk media and junk science that was out there. And I think it's important, for all of us to know, this was a study out of Hopkins. Of the 4 major world medical journals, the peer reviewers, half of them in the last, from 2020 to 2022, received $1.06 billion, the peer reviewers of these articles. And you wonder why some of the things that are shared today aren't in the literature. I'll tell you why, because the pharmaceutical companies and the medical device manufacturers paid that $1.06 billion to the peer reviewers of the literature. All right, if you focus too hard on the problem, the solution can often evade you. Informed consent went away. You know, how many people actually know what was in the product? We didn't. Most people didn't. Now we do. The other problem is we've given liability protection to the big pharmaceutical companies, plain and simple. You know, they can put whatever they want in it. They're not liable. And I think that's an important point to note. And when the science needs a pardon, that's when you know there's a problem. Here's my concern. It's not just about COVID, you know, bird flu. This is about this platform of a genetic therapy. And any gene product, as mentioned, takes about 15 years to make to market for a reason, because those cancers show up late, those autoimmune diseases show up late. The problem is these manufacturers calling a gene therapy a vaccine, they don't have to do mutation studies, they don't have to do cancer studies, and they magically have this veil of liability over them. So this isn't just about COVID. They want to do this with all vaccines going forward, not just for us, but for animals too, because it's quick and easy and very financially beneficial to them. They don't have to keep the factories running. They can ramp it up quickly because it's convenient, but it doesn't mean it's safe. And the emergency authorization at best says the only thing they can claim is the term may be safe. Doesn't say safe and effective like we've heard drumbeats for years. It only says may be safe. The SEC filing of Moderna, if you go back to 2020, their filing says it's a gene therapy. I'm not going to turn you into pathologists in my 5 minutes left here. But these products go all over the body. You know, we were told they stay in your arm. They go to the ovaries, they go to the brain, they go to the bone marrow, they go to the heart, they go everywhere. This is an uncontrolled, non-targeted product. I'm former Air Force. I was training to be a fighter pilot. Wanted my bombs to hit the target. You don't want to hit the whole population. And that's what these do to the cells in the body. They land wherever they want. The CDC took it off their webpage. They said, oh, it stays in the arm. Well, then they quietly disappeared that. Unfortunately, an intramuscular injection of any combination of substances with the intent of augmenting the immune system scientifically is dumb. It doesn't work. It makes the wrong kind of antibodies. The kind of antibodies you make in your nose, your mouth, your throat are called secretory IgA. Shots in the arm make IgG. It makes the wrong product even in your own body, if it even does that at all, which it makes a lot of wrong proteins, as Dr. Lindsay mentioned.
Dr. Cole, I just wanted to say, you got more than 5 minutes.
So
don't
okay.
rush yourself. We just want to hear your testimony.
Yes,
please.
sir. Thank you very much. Here's the problem. The pathogen gene, so these COVID shots made the spike protein. It was a gene to make the spike protein. That was carried throughout the body. The CDC, interestingly, changed the definition of vaccine. So previously, it was, something that prevented a disease. And Deborah Birx just this week, 2 days ago, said, oh, these weren't designed to prevent infection. Well, at best, that's a bad therapy. At best. They don't prevent transmission of the virus. They don't prevent disease. The claims that they save millions of lives, that big Lancet paper, was a model based on the initial incorrect predicted model of deaths. So you can't make a claim on a model based on a model. That's fantasy. The Ninth Circuit Federal Court basically acquiesced that, look, these aren't a traditional vaccine, and therefore it's akin to a medical treatment, not a vaccine. And this was in the U.S. School district, or the LA school district case recently. Antibody testing is what was done on the boosters in mice. No human trials. After the first round of shots, everything's only been done on lab animals, not on people. The booster that's out right now was designed for the KP2 variant JN1. And this was from a couple months ago, this slide. The percentage of that variant of the virus in the population right now is 0. So we have a booster that covers 0% of the variants that are out there right now. Yet the manufacturers are still giving it. And, thankfully most Americans aren't taking these now. But we literally have an expired shot for an extinct variant, and yet they're still on the market. Antibodies don't equal immunity. And this is also a lie that unfortunately we've heard over and over and over. There are good antibodies and bad antibodies. On my little organic farm in Idaho, I'm a beekeeper as well. If I get stung, I don't want to hyperreact. So my immune system over time trains my body to say, hey, we got stung again. Let's ramp up a type of antibody called IgG4, which is called a tolerance antibody. Now that's great if you're allergic to something. If you're allergic to something, you want your body to eventually say, let's quit hyperreacting to whatever it is you're eating or in contact with. But what these shots do is they ramp up this IgG4 by multiple folds, which is horrible. You don't want to be tolerant to a pathogen. So the next time you get exposed to a pathogen, because now your body's ramped this up, and there are dozens of studies from around the world that show this now, the more shots, the more boosters you get, the more tolerant you are. So next time a variant comes along, it can rip through you. Your immune system is blind. It's like a ship without a keel or an engine in a storm. And then it also these shots cause your immune system to focus on the first thing they see. So they remember that first variant from years ago to the detriment of remembering future pathogens. Now, this isn't just about COVID. If we decide to do this with RSV, which they've started, or with bird flu, the same things are gonna happen. This is known science. We've known this for decades. I knew this 30 plus years ago when I was in training at Mayo, this immune imprinting. And so why so much logical thought and science went out the window is a conundrum to me. Human cells are meant to make human proteins. So to put a gene in you and tell your cells, hey, let's make this foreign viral protein is, number one, dangerous, but number two, doesn't make any sense whatsoever. Cow cells are meant to make cow proteins. Chicken cells are meant to make chicken proteins. Mammal cells of any species are meant to make their own species proteins, not foreign, viral, or pathogenic proteins. And so when we reprogram the body of animals or people or whatever to make something they're not supposed to make, the immune system goes haywire. We have no study in the world that shows when the synthetic RNA is expunged from the body. None. This was Dr. Roltgen out of Stanford. 60 days later, it was still present in a cohort of her patients. And then she took it to publication. Dr. Brogna out of Italy showed in half of the patients in his study, 6 months after their last shot, they were still making spike protein. As Nicholas Holscher mentioned, there's a study that just came out showing 707 days later in one study, the synthetic genetic material is still present. This isn't about mRNA. You're all making mRNA right now, billions of copies. You're making bone, muscle, enzymes, digestive proteins, et cetera. We're all making it. This is synthetic RNA, and this is a genetic product. And again, unfortunately, we were misinformed. This is what Dr. Lindsay was trying to say. This was a great study out of Cambridge and Oxford by Mulroney et al. Not only is it making spike protein, this little code, but it's making Frankenstein proteins. So I'm going to take you back to biology class from probably a couple decades ago for all of us here. Amino acids are coded by 3 nucleic acids, and then the amino acids make up proteins. And so it has to read, so they're couplets of 3, 1, 2, 3, 1, 2, 3. They add together and make different proteins. So like the dog ate the cat. But what this RNA does, when it's reading that code, it can slip sometimes. So that sentence gets changed into nonsense. Now it's, you cut off the T, it's head oga et eka. Makes no sense. So what the body is doing is making other proteins in addition to the spike protein. This is why we're seeing all sorts of strange autoimmune disease. Because not only are these shots causing the cells to make spike protein, which is very toxic, it's making proteins that the immune system is going, oh, what do I do with this? And gosh, this kind of looks like my own tissue. Now you're making antibodies against that protein, which may also cause your immune system to attack your own cells of any organ in the body. And I'm not gonna give you a long science lecture. Let me just show pictures worth 1,000 words. I think this is important for people to understand. And you can find this in the book, The Pfizer Papers, which goes through all the Pfizer data that was mandated by a federal judge to be released by Pfizer because they tried to hide the data. And the FDA is supposed to be the regulator, but the FDA enjoined with Pfizer to try to hide the data from the American people for 76 years. A federal judge said, no, you'll release the data. But here's what happened in these trials that we all heard about, 40,000 patients. And then they based their findings on 0.4% of people in that 40,000 patient cohort. They used a very synthetic PCR process to make the product they injected in the trial. And right at the end of it, they started growing it in these vats of E. coli bacteria that we were hearing about. And they only had about 250 patients at the end, not enough to find any safety or danger signals. And that's the product the world got, not the one they trialed. The one they bait and switched at the very end. And that's why we're seeing these harms. They didn't study it. And then Moderna just recently took off their webpage, their commitment to post-marketing safety surveillance. They're like, yeah, we promised that, but we're not gonna do it anymore. Because they're immune. The only people that got immunity from these shots were the vaccine manufacturers, not the citizens. Adulteration, contamination, my colleagues talked about this. So this is the E. coli thing. You use DNA to make, it's the template to make the RNA, but they're contaminated with, the shots are contaminated with DNA. It's not supposed to be there. Bancel, the CEO of Moderna, even said, hey, look, we gotta clean these of any DNA because in his own patents, he says it can be carcinogenic. That is known. It's been confirmed by independent labs all over the world now. Not only contamination with the DNA, but these adulterating known carcinogenic sequences that come from monkeys, SV40 monkey virus. This contaminated the polio viruses years ago and caused a big uptick of solid tumor cancers. So this is in the Pfizer. There's Bancell's patent. That's him basically saying, look, if you don't get the DNA out, it can cause horrible immune reactions, but it can also cause cancer. Safe and effective? They're not. Here's the 30 years of vaccine data for all vaccines combined, and then you see what happened in 2020 with thousands upon thousands of deaths. CDC's own reporting system, okay, people say, oh, well, VAERS is an antiquated system. True, it only shows about 1% of the harms, according to a Harvard study. CDC rolled out an app for 10 million people signed up, and it showed a 7% rate of people needing acute medical care after these shots. I'm gonna just skip ahead. Here's the study Nicolas Holcher was saying. The more you inject, the more you infect, because it suppresses the immune system. The more shots you get, the more times you get COVID, plain and simple. Cleveland Clinic, pretty, almost as good as Mayo. No, a great institution. And this was on 56,000 of their own employees. And they found, look, the more shots you got, the more you got COVID. So it immune suppresses. So you can't find what you don't look for. People say, well, why isn't all of this all over the literature by now? Well, most institutions, and to Commissioner Didier's question earlier about, was it mandated? Most of these institutions, if you look at these things, you lose your job. You get attacked by licensing boards. You get attacked by professional organizations for telling the truth. So these studies, these long-term studies that should be done, they're not there. Now, I expect that to change with some of the new heads of new agencies in Washington. I think radical transparency is what we need. That's what we've been trying to do county by county, state by state, country by country, and we're exceedingly grateful for the opportunity to do this. I'm gonna just go to the end here. I'm a pathologist, so I'm gonna show you some pictures. This is spike protein. The little brown dots, that's in the muscle cells after the shots. The brown dots, that's in the capillaries of the brain and in the brain tissue. On the right, that's in the heart. This is the death and disability cardiovascular disease in the United Kingdom for ages 15 to 44. And you see in 21, 22, and 23 what happened. And that was after the rollout of the shots. Here's more brown dots. That's in the adrenal glands after the shots. On the right, that's blood vessels. That's spike protein depositing in the blood vessels. On the left, that's placenta. Another study just came out yesterday confirming in another model that this mRNA goes to the placenta. The spike protein, that is spike protein being expressed in the placenta after the shots. On the right, these are two different individuals. That spike protein, as my colleague said, almost replacing all the sperm in the testes. So you can't find what you don't look for. Yes, it causes clotting as well. I'm gonna skip over that. These are some of those fibrous clots you hear about. Yes, they are real. Yes, we know what they're made of. These products are not safe. They're not effective. It's not about COVID. It's about this platform technology of synthetic mRNA and genetic injections going into your citizens, into my fellow citizens, into citizens of the world. We're all human beings. We're all the same. We're all human. This isn't about, one person's science or another person's science. This isn't a red, blue, or a purple political issue. This is a humanity issue. And we're at a tipping point of making decisions to either protect each other. If the feds don't protect us, well, then the state has to. If the state's not going to, then we go down to the county level. And if our county doesn't do it, then we protect our families. But we have to protect each other, and we have to be concerned, caring citizens, and we have to do what's right for each other. In summary, and thank you for the time, you're very gracious. Taxpayer money is being wasted on a dangerous genetic injection with all risk and zero benefit at this point. We need to act in the interest of the patient, above fear, above money, above threat. I wore the uniform proudly years ago. I took an oath to the Constitution. That oath has never gone away. I took an oath to my patients. That oath has never gone away. We take oaths to protect and do what's right, and I am grateful, Let's protect patients, let's protect citizens, and let's ban genetic injections. Thank you so much for your time. I'm happy to take any questions you may have.
Questions, commissioners?
Doctor, thank you for being here and sharing with us. To be bluntly honest, most of that went over my head.
Oh, certainly.
Not being in the healthcare industry, there is a number of observations that I made. You answered some of them, but I'm just going to write down some of the notes that I took. The definition of vaccine had to change, is my understanding, in order for the COVID-19 vaccine to be labeled a vaccine. Is that accurate?
It changed. I don't know that they had to, but I think it's pretty interesting that it changed 3 times over a couple of years. And instead of saying prevent a disease, to create an immune response. Well, I send one of my lovely 6 daughters outside to play in the yard and they eat dirt, I promise it's going to create an immune response, but it doesn't make dirt a vaccine. And so I think it's very disingenuous to, as we've seen in much of society, definitions constantly change and words constantly are changing meaning. Part of the story and the question you bring up, in order to emergency authorize a vaccine product, there can't be any therapy that's efficacious against that disease. So as we know, there were certain medicines which shall not be named, which were maligned, and one of those huge studies on hydroxychloroquine was withdrawn this week because it was false data. And they use those types of studies to say, oh, there's nothing to treat this, quote, novel disease, when this disease was 70% similar to other coronaviruses. You know, we all get a coronavirus every couple of years as a common cold. A lot of us, you know, never even had symptoms of COVID because we've had it before. So to your point, long answer, short, yeah, they changed the definition.
Didn't hydroxychloroquine win a Nobel Prize? I believe it was the year before.
That was ivermectin that won the Nobel.
I'm sorry, ivermectin.
It did.
Won a Nobel Prize in use in humans.
Yeah, about almost 4 billion people had taken it to that point in time, correct.
And then when this happened, all of a sudden now doctors are being pilloried and frankly lose their license when they recommended using this horse medicine.
Well, and I love that analogy because guess what else is a horse medicine? Penicillin, ibuprofen. You know, mammals are similar in medicines. So the FDA, yeah, they they settled in the Fifth Circuit Federal Court saying, okay, we'll take down our propaganda. But even the state of Washington, you have some fantastic physicians here, including myself that still has a Washington license. They unequally applied the law. Since 1997, the FDA has encouraged off-label use of medicine. And they only went after the doctors that used ivermectin, not the cardiologist that says take an aspirin, or not the psychiatrist that gives an SSRI off-label or anything like that. So yeah, they pilloried safe, effective medicines. That medicine alone has 20 known mechanisms of action. I've written white papers on it. And yes, it's antiviral. It's antiviral against COVID, dengue, yellow fever, HIV, a bunch of other viruses. So great question, thank you.
So the COVID-19 vaccine, is it now FDA approved, or is it still being used in an emergency order?
Here's what's funny is the Moderna, the Spikevax that got a quote emergency approval covered the earlier variants that were gone years ago. And then the Comirnaty was supposedly approved but never appeared in the United States. It was only manufactured in Europe and never appeared here. And there were a lot of bait and switches with our own military members where they told them they were getting Comirnaty and they weren't. So, you know, again, we have expired shots for extinct variants.
So could you kind of give us a parallel? My understanding is the common cold or the flu that people would typically be get a vaccination, some people every year for the common flu. My understanding and understand that I'm not in the medical industry, so I'm trying to understand this the best I can. So my understanding, they make their best guess of the top 4 or 5 flu variants, and that becomes this year's flu vaccine out of a potential almost 400 variants. Is that kind of close to?
Very well said, yes. So it's always the best guess.
could you make a somewhat of a parallel to the COVID vaccine or the I don't know what we're up to 37 boosters or something to that level? I'm not sure what it is now.
Yeah. Best analogy is going to the fair and playing whack-a-mole. This family of viruses is always mutating, and it mutates fast enough that if they say, well, we formulated it for the current variant, we're ready to go, roll it out. By the time you roll it out, whack-a-mole, it's gone. And so coronaviruses, I mean, historically, I've known this since my virology courses at Mayo. Coronaviruses are known to mutate. Why don't we have a vaccine to the common cold, the rhinovirus? Because they mutate quickly as well. And so this is where we've, lost the forest for the trees, is why don't we focus on early treatments? There's a lot of money to be made in the vaccine industry and no liability, but there are a lot of safe, effective medicines. Why don't we focus on health? Why don't we focus on vitamin D levels? Why don't we focus on sunshine? Why don't we focus on our obesity crisis and the health? COVID really hit those with comorbidities, and, almost 4 comorbid conditions were the ones that did the worst. But, to your point, a vaccine against coronavirus is medically illogical. To your very point, you can't keep up with it. Same thing, the flu is a little different in terms of how it mutates, but it's still a guessing game. But coronavirus is a different story. You'll never catch them.
So back to the point you were making before, so hydroxychloroquine and ivermectin both have been shown by medical professionals to be effective to some level.
Well, Anthony Fauci was on the paper in 2005 from the NIH saying hydroxychloroquine is effective against SARS-CoV-1, which is 76% similar to this. And yeah, there are dozens and dozens of studies, not just for COVID, but for influenza, hydroxychloroquine and ivermectin, plenty of studies showing a good degree of efficacy against a lot of them.
So for this to be used in an emergency fashion, which is my understanding is what it was in the beginning, it had to have no known effective treatment.
Right, so if you can demean that which works, then you can get your emergency product on the market and make hundreds of billions of dollars for the manufacturers.
Okay, so if you take a COVID vaccine for the variant from last month, how does that interact? Is it helpful to a new strain, or how does that? I don't understand how that works.
So proteins, they shift shape, and then sugars attached to them. So antibodies are like locks and keys, and you want a very specific key to the lock. You want it to attach where it is, so your immune cells say, oh, look, that's bound to that. That's what we need to gobble up. In come your garbage truck cells, and they say, okay, that's bound to that. That's bad. Let's eat it. Get rid of it. What happens is if you get a shot and you make a bad antibody that binds partially, now it's kind of flapping in the breeze. The garbage truck comes along and says, I don't quite know what to do with that. So you got, this last shot, this last variant, and your immune cells are confused, and what ends up happening is what we call antibody-dependent enhancement. So instead, these garbage truck cells get infected by that antibody pulling the virus in instead of gobbling it up. Now you have an enhanced disease. So getting an expired booster that, the technical term is called binding neutralizing antibodies. These expired boosters don't make the appropriate type of antibody, so the immune system gets confused, and you can actually get, like that Cleveland Clinic study showed, you actually end up getting more disease because the immune system is confused and suppressed. And so, and think about it, when in the history of medicine have we said, well, to keep up with this disease, we're going to have to give you a series of 10 shots over time. I think we're up to number 10 right now.
Not 37?
No, not quite 37, but, hyperbolically, if there's money to be made, we may get to that point.
Thank you. So a couple other observations, I guess you would say, that I've made. And really the only way that I can kind of make a parallel as somebody that's in the land development business, not in healthcare, is I can't tell you, I can't count, I don't have enough fingers and toes to count the number of times that I've heard that people say, well, this is best practices. Well, according to who? And so that's something. And so with that, the parallel I would make is we heard over and over dozens of times on a daily basis that there's a scientific consensus. Could you speak to that? What does scientific consensus mean? Because that's not science as I understand it.
No. If there's consensus in science, it is not science. The moment there's consensus, science is dead. Science is a process. The science is settled is censorship. Do we still do ice pick lobotomies? No, we don't. Do we still use leeches? No, we don't. Do we excessively prescribe opioids anymore? No, we don't. Do we use mercury for syphilis? No, we don't. Do we radiate acne anymore? No, we don't. I can go on and on. The list of things scientifically and medically that have been done over the centuries that we look back and go, oh my goodness, why did we do that? To say that there is consensus in science is to say somebody's not thinking.
It appears to be a direct oxymoron.
Absolutely. General Patton said, if everybody's thinking alike, then somebody isn't thinking.
So one last observation, since I've been hogging all the time. So I read the Hippocratic Oath. And so the Hippocratic Oath is an interesting thing that it's had a few adjustments over time, but it appears to go back as far as 460 BC or 275 AD, but that's a long time ago. That is a very, very long time ago. And it's the primary piece of that for a physician that takes that oath is first do no harm.
Amen.
That is the first component of that, and I would say if you boiled that Hippocratic Oath down, that's what would remain, is first do no harm. And it appears that with scientific consensus and all of these things that have happened, hydroxychloroquine is a horrible, evil thing that will cause everybody to die, makes no sense, and especially when you have taken the Hippocratic Oath of first do no harm.
And I would like to add to that, because that's a brilliant observation. It's not just physical harm, but think of the psychological harm that was caused, and the financial harm that was caused, and the societal harm that was caused in the name of science and in the name of consensus. So thank you for bringing that up. And I implore my colleagues in medicine, yes, there's forgiveness, but at the same time, there has to be repentance. And a lot of the medical profession, wittingly or unwittingly, participated in something that was horrendously harmful.
Commissioner Mullen?
Oh, I just want to say thank you for coming today. It's been very informative, and I'm glad I didn't take the shot.
Well, thank you, and it's an honor to be here. And again, we know it's a lot of information. We're not going to turn anyone into a scientist in one day, but hopefully just the bigger picture of it's not about any of us. It's about all of us. We care about that oath. We care about those patients. Yes, we've been maligned and silenced, but we're grateful when there are those that will at least give an opportunity for the truth to be heard. So thank you so much. Appreciate it.
Thank you.
So if I might add to your list, back when we were becoming a country, they bled people when they were sick.
Yes, they did.
And I'm glad they quit doing that. But a couple things. On this, it says here that current no study or publicity known mechanism exists for an off switch to stop the production of this toxic spike protein, which is the synthetic molecule. Is there anybody that's working on that right now? And well, the second question is, how does that spike protein that is synthetic reproduce in your body?
Well, one of two ways. It's either integrated into the nucleus of your cell or sitting right outside that nucleus in the cytoplasm.
Okay.
But it's sitting somewhere if these studies are showing these patients. Most of these studies, again, because of censorship in science and because of threat of reprisal, most of these studies have been done by those of us out of our own pockets. A lot of those slides I showed were from my laboratory when I still had it before all the attacks. Some of them were from my late great colleague, Dr. Arne Burkhardt in Germany. But all of these have been privately funded because we couldn't get the NIH funding. And again, you can't find what you don't look for, but these studies should be done in, you have a fantastic university. University of Washington is a great research institution, so is Washington State. They should be doing that. They have all the equipment, they have all the chemicals, all the reagents. The only thing they're lacking is the courage to do it. They could do it tomorrow, faster than we did independently, out of our own pockets.
And then on our resolution here, it also states, and this is just a statement, not a question for you, but it states, prohibits, mandates, local, state, national, and global regarding medical procedures or interventions in any modality. So this resolution we're passing prohibits mandates. And I think we're all looking to make sure that we do that, because it's your free will. It's your decision if you want to take a vaccine or wear a mask. And
Informed consent.
Informed consent. And yet fear took over this nation, and they use fear to push this mandate. And our Fourth Amendment right says we're secure in our own person, and that we can't be searched without our permission unless there's an arrest warrant, or we can't be injected with something without our consent. And so saying that we were derived from this God's will, this country was ordained, the Christian values, I'm all for passing this resolution today. And I thank you so much for taking the time to come to Franklin County, and I hope we create a movement. But I thank you for your courage, for stepping out and being the front man with these other doctors that we heard from today.
Well, as
Stopping this.
speaking for the team, and we're humbled and honored, so thank you.
Thank you, Doctor.
With that, I'll make the motion to approve Resolution 2025-076 as presented.
Second with discussion.
There's been a motion and a second for Resolution 2025-076 with discussion.
Thank you,
Bell.
Mr. Chairman. A couple of the observations I would make about this resolution that's in front of us. In a number of ways, I don't think it goes far enough, and it would be my preference that we adjust it to make it stronger in a couple of ways. One of those specifically being that we are for freedom, and the freedom for people to make the choice of their own. And so I don't believe this describes strong enough that we are against mandates, against requiring people. There's many people in our community lost their jobs. They were required to do it, and it became very, very coercive. It became, there was sections in sports stadiums of the vaxxed and the unvaxxed. It drove a wedge into our community, and I think that it does not speak strong enough to what I believe our voice is of saying we are against mandates, against the government requiring. And so that would be an observation that I make. The other observation is we're making a statement of our belief in freedom. And this resolution in front of us today is very long, and it has information here with words and descriptions that are over my head. And I believe that is it doesn't do a service to our community to have something that isn't understandable except by medical personnel. So that would be my a couple of observations about this. I don't think it speaks strongly enough in those two ways, and so I'm not against passing it today, but that's just a couple of observations that I would make that it could speak stronger in those ways.
And I would agree with you, but I think it's important today, with the momentum that's going on, is to pass this. We can always amend it. We can always redo it. But I think it's very important to get the ball rolling in Washington State at this point in time. So is there any other discussion?
No, I think we should pass it. I mean, what's been done to the citizens of our country it's unacceptable and it's horrendous.
Well said. If there's no further comments, all in favor say aye.
Aye.
Aye. Did Commissioner Bauman, did you vote?
I did.
Oh, I'm
Aye,
sorry. You
yes.
guys were unanimous. I didn't hear two voices. I only heard one. So with that, congratulations, Dr. Cole and the team. Thank you so much for coming.
Thank you.
You're making a difference in the world. God bless you.